Today, let's talk about healthcare. Some good news and some scary news. I'm going to focus on two things and tell you how they're shaping the healthcare landscape in the United States, but also how much we'd lose if they were repealed. First, let's talk about the Affordable Care Act, the ACA. Thanks to the Democrats' efforts, healthcare costs have significantly dropped. Now, a record number of people can access quality and affordable healthcare. Remarkably, 80% of people find coverage through the ACA marketplace for $10 or less per month. And this isn't just about numbers. It's about real people getting financial security and better access to care. The ACA has been a game changer for families across the whole country. With the ACA, the families can, rest easily knowing that they're not going to go bankrupt over a medical emergency. And more importantly, thanks to the ACA, pre-existing conditions won't lead to discrimination or higher costs for basic coverage. So the potential repeal of the ACA would have widespread consequences. Over 21.3 million people benefit from its marketplaces, and more than 22 million are enrolled through Medicaid expansion. If the ACA is repealed, 135 million people in this country with pre-existing conditions would lose critical protections. And a million more people would see increased cost of medication and lose access to free preventative services. Now, let's talk about another law that passed thanks to Biden and the Democrats, the Inflation Reduction Act, which is significantly lowering insurance premiums for working families, saving an average of $2,400 per household. This law has dramatically increased the number of insured Americans and giving them more room to pay for other necessities like food, gas, and rent. ACA enrollments have almost doubled since President Biden took office, reaching the highest in ACA's history. But this is where things get a little dicey. We have some heavy lifting to do. Here's the deal. Congress needs to step up and make those tax credits from the Inflation Reduction Act stick around for good, because they're set to disappear in 2025. And we can't let that happen. These credits are key to keeping healthcare affordable and accessible for everyone. We've come a really long way, and we do not want to lose that momentum right now because these benefits are under threat. Donald Trump has renewed his attacks against the ACA. He's trying to terminate it. This plan, backed by MAGA Republicans, is trying to dismantle these crucial healthcare measures. Every Republican in the House and in the Senate voted against lowering drug prices, reducing healthcare premiums, capping insulin costs, and improving care for seniors and people with disabilities. Let that sink in. Under the Republicans' plan, the 22 million people benefiting from Medicaid expansion are at risk. And despite Medicaid expansion's life-saving benefits, Republicans have consistently opposed it, denying millions access to essential healthcare. The Inflation Reduction Act has widespread bipartisan support among the public, and it passed without a single Republican vote. Now, those same lawmakers are working to repeal its crucial drug pricing measures, driven not by public interest, but by corporate greed. So let's talk a little bit more about that. Drug companies, their executives are fighting tooth and nail to keep prices sky high. And who do you think pays the price? We do. If they get their way, we're talking about paying more for our medications, seeing Medicare premiums go through the roof, and that's especially rough for our seniors. Here's the thing about the ACA and the Inflation Reduction Act. They're huge steps forward in making healthcare affordable for all of us. But guess what? This progress is hanging by a thread. It's like a showdown between what really matters, our health and our wallets, and on the other side, big corporate profits and political games.